The new concerns over kids and COVID. The American Academy of Pediatrics is now reporting more than 23,000 pediatric COVID cases in just the last week. The spike is raising added concerns about slowing vaccinations. Right now, nearly 162 million Americans are fully vaccinated. That's 57% of the eligible population. Whit Johnson has the latest.
This morning, the U.S. facing a COVID resurgence. New cases tripling in the last month, driven in part by the Delta variant, now estimated to make up 83% of new infections. Hospital admissions on the rise in 36 states.
This group that we're seeing now absolutely could and should have been prevented. This is becoming a pandemic of the unvaccinated.
On Tuesday, California reporting more than 5,000 new cases, numbers not seen since the winter surge 5 months ago. And now growing concern about unvaccinated children. More than 23,000 new pediatric cases in the last week, twice as many as the end of June. In Georgia, the family of Wyatt Gibson says he was a healthy 5-year-old before passing away on Friday. They say he contracted several infections, including COVID, strep, and staph days before. The virus spreading rapidly throughout the South. In Alabama, Dr. Brittany Cobia says she's seeing healthy young people with serious COVID infections. Writing on Facebook, one of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and tell them that I'm sorry, but it's too late. Health experts warn that Florida, where the full vaccination rate is below 50%, is most vulnerable. 41-year-old James Scott Owen is not vaccinated and currently battling COVID-19 in a Florida hospital.
Having to remind myself to kind of relearn to breathe. But now that I have had the full cycle of symptoms, I would definitely have opted to get it.
And overnight, the state's attorney general announcing that she has tested positive despite being vaccinated earlier this year, tweeting, "Thankfully, I am only experiencing mild symptoms and my family is in good health. As I continue to self-quarantine, I want to encourage Floridians to be vigilant about their health." The latest surge raising questions about breakthrough infections. Overnight, an outbreak in Provincetown, Massachusetts, growing to at least 256 cases. Officials saying more than 2/3 of those testing positive are fully vaccinated. And this morning, the Washington Post is reporting that top White House officials are currently debating whether to urge vaccinated Americans to once again wear masks in more settings. And overnight, during a town hall, President Biden suggesting that the CDC could also soon update its mask guidance on children in schools. Diane?
All right, Whit Johnson, thank you. And let's bring in ABC News contributor Dr. John Brownstein from Boston Children's Hospital for more on this. Dr. Brownstein, thanks for being here. You know, new cases in general have tripled in the last month in the U.S. California is reporting numbers they haven't seen since the winter surge 5 months ago. So I hesitate to even ask it, but are we headed back to mask mandates or even lockdowns?
Yeah, I know this is not the question we want to be asking ourselves. I know we feel like this is a bit of a Groundhog's Day situation. Delta is gaining momentum, and short-term public health measures in specific areas may be important, but this is not sort of blanket lockdowns and mask mandates. You can't look at the country in a uniform way. This is about pockets of unvaccinated people that continue to be the hosts for this virus. So when you have unvaccinated or under-vaccinated communities, increased mobility, reduced mask wearing, social distancing, that's when we're going to see these surges. And we have tens of millions of Americans that are vulnerable. So you have Delta moving forward. You're going to have to bring in some mandates, but blanket guidance is not going to be helpful. Rejecting mask mandates is also not helpful. So we just have to have that kind of flexibility and recognize that in hotspots, we may need to do more. We may need to mask inside in large gatherings, maybe if you're vaccinated, but overall, this is going to be about people making decisions based on their own risk tolerance as well. We're just going to need more nuanced recommendations. I would love to see vaccine IDs come into play like we've seen in other countries, but I think that's going to be unlikely to play out across the country.
Now, we're also now hearing about this Lambda variant. It's now detected in Houston. So what do we know about that?
Yeah, I know we're quickly going down the Greek alphabet. I'm not really sure what happens once we get to the end, but Lambda was actually identified in Peru, swept across South America. It's now in several US states. We've only seen about 700 cases. It's nowhere near what we've seen with Delta. It's still too early to say. WHO only classifies this as a variant of interest, so not a variant of concern yet. So we have to keep an eye on it. We haven't seen any major concerns about increased transmissibility or severity. And most importantly, the data we're seeing around vaccines shows that they work incredibly well to protect against Lambda, especially the mRNA vaccines. I know there's some mixed information about J&J, but they all work against what matters, which is severe illness and death.
Now, pediatric cases are also on the rise, more than 23,000 in the last week. That's twice as many as we saw at the end of June. So how concerning is that?
Well, of course, any amount of cases in our pediatric populations is concerning, and it's something we have to be watching. Unfortunately, most of our kids are unvaccinated. They're not eligible yet. And this is why it's so important for the adults around them to be vaccinated. And, we've spoken about this so many times. Kids are not necessarily at greater risk of becoming seriously ill. But of course, we have the concern of long COVID. And for some kids, this is a severe impact. And so we don't have definitive data on whether Delta is more severe, but if you just have a lot of virus circulating, our kids will get infected. And so for that reason, in those hotspots, kids need to continue to mask indoors, and especially around unvaccinated people, or when your community is experiencing a surge. So yes, unfortunately, a lot of burden is going to be placed on our kids in these hotspot areas.
Now, we're also hearing about this outbreak in Provincetown, where more than 2/3 of those testing positive are said to be fully vaccinated. How worried should we be about breakthrough infections right now?
Yeah, I'm a little bit mixed on this. And of course, we need to be constantly vigilant about these breakthrough infections just to understand the state of this pandemic. But remember, we have 160 million people vaccinated. Breakthroughs are going to happen. It's just a numbers game at this point. But what we're seeing very widely is that these cases are mild, they're often asymptomatic. And so you have to be careful about calling these breakthroughs, clinically relevant. So I really just want to caution people from getting too scared about, the vaccines not working. They're working incredibly well. They're over 99% effective at preventing death and severe illness. And so that's what we need to focus on. Of course, we need to keep watching these breakthroughs to see the impact that they're having at the community level. But the anecdotal reports or the small clusters of cases among vaccinated people is not creating, a significant concern for me right now.
Now, the CDC's Advisory Committee on Immunization Practices is meeting today to discuss cases of this rare side effect from the J&J vaccine. What's the latest on that, and what do you expect from that meeting?
Right. So the ACIP has been the committee that has really worked to think about recommendations around the three vaccines that we have. They recommended the 12 to 15-year-olds to get the Pfizer shot. And now, of course, they're looking at this data around this rare Guillain-Barré syndrome. It was only about 100 cases of this rare neurological syndrome, of course, across 13 million people that got the J&J vaccine. So very small numbers, of course, meaningful. So the FDA put a label warning. But what I expect to see from the ACIP is that they're going to look at this risk-benefit analysis like they've done throughout the pandemic. And they're going to say that the benefits of J&J far outweigh any risks. Of course, there's going to be conversations that have to happen with providers around potential risks of Guillain-Barré. But overall, I doubt there will be any significant impact on the recommendations for this really important vaccine.
All right, Dr. John Brownstein, we always appreciate your time. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.